Hey folks, thank you so much for tuning in. I greatly appreciate every time you tune into this channel where we talk about positive mental health. And today we are going to be having a discussion, a talk about drug addiction and alcohol use. In medical terms, with this, a drug can be referred to as any substances that, when taken into a living organism, is able to modify one or more of its functions of that organism. Drugs can provide temporary relief from unhealthy symptoms, or is able to supply the body with the necessary substances that the body can no longer make. And some drugs, produce unwanted side effects, and some lead to unhealthy dependence that has both physiological and behavioral roots. The mind, as I've always said, is our most important tool. Is the most important organ that we have as human. With it, we're able to solve problems, we face in life. And drugs do several things that harm a person's ability to think or to be fully aware of the present surroundings. These effects continue long after the effects of the drug appear to have worn off. Addictive drugs activate the brain reward system. The promise of reward is very intense, causing the individual using the drug to crave the drug and to focus their activities on getting and taking the drug. And the ability of the addictive drugs to strongly activate the brain's reward mechanism, and their ability to chemically alter the normal functioning of the brain of this system, can produce an addiction. Drugs also reduce a person's level of consciousness, impairing their ability to think or be fully aware of present surroundings. So all this talk, all this description is just telling us, what addiction is all about: drug addiction, alcohol use, and all those stuff that fall within that category. The drug taker is not moving in the same series of events as others. This can be slightly, like where somebody is seen to make occasional mistakes, at times due to people under the influence of drug. They are persistently making mistake, or it can be seen as a serious or as total insanity. The person is out of touch with reality because of the impact of drug affecting their functioning. When the events appear to him are completely different from those apparent to anyone else. Like there's a kind of uh, perception, the way they perceive things is completely different from other people, what their brain is interpreting to them, because the functioning of the brain has been affected by the drug that they are using, being a drug mind altering substances. It is not that the drug user does not know what is going on, is that he perceives something else going on instead of the actual series of event that is actually happening in their surroundings. And that is what drug addiction or alcohol use can do when people get out of in touch with reality. Drug addiction, is a lifestyle of addiction which begins with a problem. Every woman is bound to face with one problem or the other, or discomfort, or some form of emotional or physical pain, that someone is experiencing. And this can be a very difficult thing to deal with. Like, as human, no one likes pain, both emotional or physical pain, but people make different choices to deal with their problem. And then people start off, like an individual, like most people in our society, and then this person encounters a problem or discomfort, as I've said, that they think, oh, it's overwhelming, it's beyond them, and they don't know how to resolve the problem or confront the situation that is there before them. And this may make people to like such problem as difficulty in fitting in, like among the young people, like fitting in, or like teenagers, adolescents, sense of belonging, and all those experiences. And then anxiety due to peer pressure or to work expectations, such or identity problem, or like marital problem, in marital problem in people and all that. can or identity, divorce as an adult, problem, marriages, childbirth. It can also include physical discomfort such as injury or chronic pain. The person experiencing the discomfort has a real problem. He feels his present situation is unbearable, yet sees no good solution to the problem. Everyone has experienced, in their lifetime, to some extent, one problem or the other confronting them. The difference between someone that turns to drug and someone that, look for other solutions, or maybe like asking for counsel or problem solving other strategies, is the choices that everyone has to make in life. And most of the time, people make some choices. There's no judgment, it's not judgmental. We are just having a discussion so that, like an education literacy for people to know that, what can lead to this situation. And because once they get into it, people get hooked, and it may be a very difficult thing, to get out of. So, or like alcohol use as a solution to the unwanted problem or the discomfort that they are going through at that problems. And then let's talk about drugs and problems. People try drug or alcohol because as at that time, when they are going through problem, overwhelming situation, like making a choice of using drug or alcohol, appear to be like problem solver. Yeah, no one wants to go through pain, emotional or physical pain, and then they feel better that because, for temporarily, it seems like, able to help them, get out of that problem or that situations that they are going through. And then to them, the drugs or the alcohol becomes valuable, temporarily. And before they know it, like it's able to take off the unwanted feelings, and they see it's like a solution, like a cure, like a saver, a lifesaver, but it's just temporarily. So they continue, to use maybe drug or alcohol, to become a solution to whatever discomfort that they are going through at that problem. And as I said, they see it as a valuable tool, to turn to help them to feel better. And then this is the main reason, some people, they use drug, as I said, or turn to alcohol, to just get out of whatever problem, whatever overwhelming situation that they are going through. And this, most of the time, like all these habit forming drugs, mind altering drugs, temporarily attempt to resolve the underlying problems, but it's not. In the long run, it has its own discomfort, it has its own side effects, and most of the time is turning to become addiction. The body getting used to it, and it becomes difficult to get off such. The person that is making use of the drug becomes trapped, and it's the drug is not able to solve the initial problem that they thought the drug or the alcohol is going to deal with, but gradually, it affects them. It affects, their mental functioning, their ability, their social functioning. And at this point, they are not even thinking about the problem again. The new problem that arises is how to get the drugs, how to get the alcohol. And then with this, they lose the ability, the drug or the alcohol take the control of their life, and it becomes, the consequence is horrible as at this time. And what's some of the behavior of drugs, and behavior is that, like now, the person that has turned to the drug or alcohol, as a solution is see like the drug or the alcohol as now, like, they're, like I've said, like a lifesaver. And then because of this, they want to be hiding, from friends, from family members, because now they are being compelled, the tolerance to seek this at all costs. And then the suffering, in silence starts, gradually, and then they become dishonesty, to people around them, to family, to friends. And then they start to isolate, they start to withdraw from people, and then they start to behave strangely. And then the phase they get to is that the more they use the drug or the alcohol, the more that they want, the more of that of the drug they want, the more, and then they become guilty about that. And at some point, they become depressed, they are not happy. And that's what I said, that the new problem is not the initial problem that led to the use of drug and alcohol to get out of the initial problem, but the bigger problem is they have just to continue to get the drug and alcohol every time to keep up the side effects or the withdrawal effects of not getting the drug. And then this affects them as human beings. It affects their integrity, it affects their relationship with friends, with family, it affects their job, it affects their finances, because they invest a lot of money into getting all these substances, and they are not cheap. To get more of the drugs, to get more of the alcohol. And this becomes another problems affecting relationship, job, and everything can start going downhill. And like some, they lose employment, they lose partner, they lose friendship, a lot of losses that are being encountered because of the effect of drug use. And as I've said, as time goes on, tolerance develops to the drug and to the alcohol use. Apart from the mental stress created by this unethical behavior, the person that depends now solely on the drug use and on the alcohol, because their body have adapted to the presence of all these chemicals, which is also mind altering. And then the new experience now is overwhelming, is because they are really now obsessed with the chemicals, the structure, the chemical changes, in their brain, their system, because of the new chemical of drugs and alcohol they've brought on their system. And they want all this, by all means, to avoid the pain of withdrawal that is going to come up, if they don't get the drug of alcohol. So by all means, they are hooked. And then they continue to seek, this drug, just now, two things, both for the reward of the pleasure and then to avoid the mental horrors of withdrawal symptoms. So the one problem they were trying to hide from has now multiplied to become a complex problem. And then because of the reward, it makes them to get high, and then they think temporarily they get out of their problems, but it's just temporarily. A complex problem is being develop as a lot of that. At that point, it's the person gets into a vicious cycle, and then the person gets stuck because of this new behavior of this drug. And then the person became a changed person completely, both physically and mentally, because they've crossed the invisible and the intangible line of getting control. They've lost control to the drug, they've lost control to the alcohol, and it is now the other way around. That is the alcohol and is the drug that is taking hold of their life, of their job, of their relationship, of their family, of their finances, controlling them. And they just become like, the drug and the alcohol become their master, and they just like become enslaved, to this habit. And a lot of things, about their life is being impaired. And this leads to some other complex mental health problem, and then can lead to personality change. In this individual, somebody that that is easygoing, is friendly, and is warm and all that's pleasant. We just can't understand the individual anymore, and that is when the drug personality like kind of behavior is being observed in this person. It's a kind of artificial description that is being created by the impact of drug in the life of this individual that affect their behavior, because now they become secretive. They don't want people to know about what they are doing. They become hostile, and then the internal guilt, and then they just like to cover up because of all what they are doing. And unfortunately, to some a significant percentage, even like drug use, is connected to crime. because now they become secretive. They want to do anything possible, in getting drug, and then affecting their social life as well. And then on the mental aspect, you start to observe, like I said, their mental health is being seriously impacted. Like the mood, like depression is there, and that's why they need it again and again for the reward. And then to avoid the reward, the withdrawal signs. And then the mood, you start to see changes in their mood. Their mood, they experience mood swings, from time to time. They become unreliable. They are unable to finish any project, so it affects their work. If they are working, if they are doing a business or whatever they are doing, it affects it. They are unable to finish any project. They become secretive. They become dishonesty. They tell lies to families, tell lies to friends, tell lies to the employers, involved in crime, in violence. They fight, and they withdraw, from people, from their community. They just want to be alone. And with isolation comes the depression as well. And then at times, in extreme cases, because everything is just going the opposite direction for them, their functioning is declining, it affects them, and then they need to get money, to be able to get more drugs or more alcohol, and then they start to steal. That's the connection about crime that I talked about. So they start to steal, maybe from family, from friends, and because they needed money to get this drug, by all means. And that is the negative aspect, about drug. And that is why we are doing this education, this literacy, that people that will not just be a novice, they understand how these things goes. Every individual, every human being in life, at one time or the other, will be faced with problem. But the choices that we make, and as I've said, it's not judgmental, but a lot of people, they do not know. They are naive, to the end of the road. That is, after this drug, what next? After the effects of the drug and the alcohol, what next? And that is why I'm bringing this education, this literacy, that people will know and avoid it. The people that get hooked to it, we are here to support, we are here to help. As I said, I am Dr. Debbie. I'm a mental health clinician, and I'm a licensed certified psychiatric doctoral prepared psychiatric nurse practitioner. I practice in the United States, in the state of New York and Maryland. I support people and treat people, prescribe medication assisted treatment for people that struggles with addiction, Suboxone, and some all other medications that we use for people, to with the medical help, to be able to get out of addiction and feel and face their life and fulfill their potentials, and be able to live out their dream as human, and go back to the life that they are able to enjoy life. They're able to enjoy family, friends, and every human functioning. And that is why I am here, to educate about this. I hope you learned something. And it's me, Dr. Debbie, your mental health clinician. You can reach out or connect and check my about to learn more about this. Thank you so much for your attention. Be safe. Bye.